later life health is very important in women because it's at that time that women can start to develop heart disease, blood pressure problems, diabetes, and thinning of the bones. So by following women from early pregnancy through to 10 years after pregnancy, it allows us to understand those factors that are associated with heart disease and thinning of the bones. So the ROLO study is a longitudinal birth cohort study where we recruited 700 mothers in early pregnancy and have had the opportunity to follow those women 10 years, following both the mothers and the children for 10 years after that pregnancy. And this type of study is hugely important because it allows us to look at the woman's health over her life course. So taking her health in pregnancy and then looking at her health in later life when perhaps she's finished her family. So we recruited women in early pregnancy who already had a large baby in a previous pregnancy, and we wanted to see whether pursuing a low sugar diet would reduce the chance that she would have another large baby. And we've had the opportunity to follow those mothers and children at 2 years, at 5 years, and now most recently we've just finished the follow-up of mothers and children at 10 years after that pregnancy. And we have recently found that mothers who had diabetes or blood pressure problems in pregnancy were more likely to have markers of heart disease at 10 years. And that paper has just been published. And now we're going on to look to see if, for example, if she breastfed or if she's able to maintain a normal body weight, will that reduce those risks? So currently we're looking at that data and we hope to have those results in the coming year. So one of our really exciting findings from the ROLO study is the impact that breastfeeding can have not only on baby's health, but on mother's health. So we recently looked at women who breastfed and found that those who breastfed 10 years later had less evidence of markers for heart disease. So this is really exciting, and it tells us that women who breastfeed, and if they breastfeed for longer, that will reduce the chance of them having problems with their heart in later life. And of course, problems with the heart in later life affects up to 1 in 4 women. So this is a lovely, simple, natural intervention that we can support our mothers to do to help their health. We additionally have found that breastfeeding in the ROLO mothers was associated with less body fat in their children at the age of 5 and 10. So that tells us that breastfeeding reduces the chance of overweight and obesity in their children, while also helping their own heart health. So 2 really good messages there to support women, not only to start breastfeeding, but to continue for at least 6 months, if at all possible. So one of the things we've looked at in ROLO is mother's mental health well-being. And what we found that in pregnancy, certain healthy diets was associated with better well-being in pregnancy. So these included eating vegetables and folic acid. So those women who had good vegetable intake and folic acid had better well-being in pregnancy. We also found that women who exercised regularly in pregnancy had better well-being. And then we also found that most recently we looked at breastfeeding and we looked at mothers' mental health 10 years later. And we found that those that were able to breastfeed and breastfeed for longer had better well-being 10 years later. So this is very, very exciting data. We know that mental health is hugely important, and to think that breastfeeding will improve well-being, not only immediately for the mother, but on into the future is very exciting indeed. Well, we at the National Maternity Hospital are very, very grateful to the donors of the NMH Foundation and to those who support the NMH Foundation. It allows us to continue the good work we have here. It allows us to be at the forefront of cutting research so that when women and their families attend us here, that they know they're getting the best care.